Dr. Oliver Hartwich, come on up, and Rob Hennin, please, for a final few words. So much to process, so many great speakers and so much insight that we had today. I want to start with you, Oliver. I know you were particularly interested in our talk around mental health.
Yes, I was interested in the talk about mental health and the intersection with localism. I should probably say at the beginning that at this conference I feel like an imposter. Because you're all the great experts on health and health policy, and you're doctors and you're specialists, and I'm not. I'm a generalist, and sometimes I write articles for newspapers. But I have one practical experience, actually, that takes me back really 30 years, that links into all of these issues, and I just wanted to share that with you because I got reminded of that experience just listening to all the stories today. As you may know and might have guessed, I'm from Germany. And in Germany at the time, we had a military draft when I finished school. And so you had the choice. You could spend 12 months in the German army, or you could do 15 months of something else. And because I was sure that I would be the first to kill myself trying to clean my gun, I did 15 months of something else. And I worked in a daycare center for people with severe mental problems. And that story is actually quite an interesting one because I worked in an organization that came out of a complete localist grassroots initiative. So the story there takes us back to the 1970s when there were relatively few mental health institutions, and it was certainly not as well developed as it is today. And in my state where I'm from, there were only 2 hospitals with closed wards, and the patients were all centrally kind of dealt with there. Problem was for their relatives living in the places where they came from, that was a problem then even to visit. And they started organizing a bus shuttle service. And so regularly, once a week, there was this bus shuttle going from that place to the hospital that was far away. And out of that came an initiative that over time actually realized there are relatives of people with severe mental problems, and they all have the same problems. They wanted to do the right things for their family members. And they started off with the bus shuttle service. They then started organizing assisted living arrangements where social workers took care of their relatives and actually gave them a better day structure. Then they started the daycare center in which I worked. They started a workshop where they could actually learn their crafts and where they could structure the days better. And the mental health outcomes for these patients were fantastic. But crucially, this was a localist initiative. So this was totally driven initially by relatives, of course, got state funding eventually. But it's still, to this present day, actually a localist project, still run as a registered society, a registered club, from relatives for relatives on a localist basis. And when I listened to all the discussions we had today, that reminded me very much of that experience. And I think we need more of that, because if there's one thing that really came out of the discussions we had today is that centralist solutions really have been tried to and tested to destruction in New Zealand. We've tried to centralize everything in this country. And from what I heard from all of you experts today, is that it really doesn't work. And it is high time now to actually bring this back down to the specialists and the people actually affected by the things locally, whether that's doctors dealing with their patients, whether it's the patients or whether it's the relatives of the patients. But there is a lot more dispersed knowledge out there, which you can't centralize in any central structure, whether it's previously a DHB or now Te Whatu Ora. And so I think the pendulum is now swinging mightily back from the centralization we've had, and that can only be a good thing and a good news story for issues like mental health.
When we talk about localism, though, Oliver, you know, it's a chicken and an egg. You know, where do we do? What do we start? Who rips the cord and gets this underway? Do we just have to start building?
Yes, and actually that's another thing that I thought about today, because it's the same discussion that we've had at the initiative. So for 12 years at the initiative, we've been promoting policies to bring decision-making to local communities. We did this actually when we started with house building and residential development and transport. And these were the areas in which we argued for devolution and subsidiarity and localism and whatever you want to call that. And typically the response I would get is actually, have you ever talked to a mayor or a councillor in this country and you want to give these people more power and money? And don't you know that we've got absolutely zero capacity there, and you can't actually give them any more responsibility, and for the time being think we're much better served, even though it's crap, but we're much better served if we just keep relying on Wellington. And so it is a chicken and egg thing. I'm still convinced, actually, that we would get, over time, much better solutions and much better outcomes if we trusted the locals. But right now, of course, the problem is there is no capacity because we haven't actually asked them for decades. And I think when it comes to health, it might be the same issue. We haven't quite got the structures yet, and yet we have reasons to believe that in the long run they would produce much better outcomes. So it is a chicken and egg problem, but I think that shouldn't stop us from trying to devolve, because I think in the long run that short-term pain of trying to actually build that structure and building that capacity on the ground is definitely worth the pain of the longer-term gain.
Rob, one of the things Cecilia said on a couple of occasions is that it's not rocket science. But then I guess when you look at what we've heard today, I kind of think it is. I mean, it's a lot, right?
Yeah, so the other way of saying it's not rocket science, they often say it's not brain surgery, right? But this is an industry that does brain surgery. I was thinking about that because it came up a couple of times. It's not rocket science, but it is really complicated. And so, again, I come back to, I think, where the theme of today, Oliver's just said it, and in the mental health session, someone put up, I think it was Rachel, put up a slide that said, local people, local initiatives, local ways. And so the only way, if things are really complicated, the only way to break it down and get it simple is to make it smaller, and to be able to execute in a local way. And so it's not rocket science, but it is complicated. And so we kind of need to get local, we need to get small, and we need to execute.
Rob, what did you make of Lester's comments, his commentary?
So I've never heard Lester speak before. And so I was quite impressed. I thought... and he went straight out of here, and there's an article in the Herald that sums up his presentation really well. I took a couple of points, but my two main points were, he said, change what needs to be changed. And I thought that's good. That's about focus. And then he said the other thing is we need a combined operating model, and it's actually in the article he spells it's spelt out. But funding and delivery shared, a combined operating model, and I thought those were really impressive things. So the talent in this room, the talent that's not in this room, in the ecosystem, working together to do it in the best possible way.
Oliver, when you think of the size, and I guess what we've heard today about the size of the issues we're facing, and if you look back over sort of past leaders and what they had to deal with, and you think of John Key and Bill English had, the GFC and the Christchurch earthquakes, and Jacinda Ardern had the mosque attacks and COVID, and Chris Hipkins had the cyclone and the floods. It feels increasingly, when you're looking at what's being reported on and what's coming out of, situations like this, that perhaps this is Christopher Luxon's issue to resolve. It is the state of our health system, potentially. What are your thoughts on that?
Yes, but at the same time, it's also the state of our education system. It's the state of our transport system. It's the state of our
really
public...
depressed. Yeah.
Yeah. I mean, if it was only that, yes, I mean, that would be nice, and it would be a seminal moment, and this is the Prime Minister who fixes the health system. But actually, this should be the Prime Minister who fixes almost everything, because it's all broken. That was actually the interesting thing, actually, in a lot of the comments today. You could have actually replaced pretty much everything in what Lester Levy said. Just take the word health out, put education in, and you would have exactly the right description of the problems we face there. I think it's a systemic crisis of actually how we do government in this country. And that is a massive job to fix. And you have layers of bureaucracy in health, but you have layers and layers of bureaucracy in the Ministry of Education and in other ministries too. So actually, maybe this requires a more fundamental rethink of actually how we organize government, how we organize the public service.
Rob, quite a lot for you to absorb, I think, from today. If you're going back to the team at NIB, what do you think you'll be talking to them about what you've consumed and observed today?
Keep going, guys. Yeah. In fact, straight back to the office after this, if we can. Yeah. Look, I hope you feel, as an audience, encouraged. I feel quite encouraged today because, and Hamish said, as you put your silos pictures up, and I kind of identified, looks a bit like our business, really, but just small. Well, the health system's bigger, but you said working together, smart clinicians. I think you said smart CEOs. I hope you said smart CEOs, but smart clinicians and smart CEOs, smart people working together will solve this, I think. And so again, I take back to our business. There's a great opportunity for us as a business, but also as people. I mean, this is about community. It's about people as New Zealanders. And Cecilia said it. There's only 5 million of us. We're not that big. If we really again thought about it, we should be able to solve this.
Some final thoughts for you, wrapping up, Oliver.
There's a contrast actually between what we had today and last year's first Health Innovators Summit. A bit of a backstory, really. Before we had the first summit, I had a longer chat with Bill English and asked for recommendations, what should we look at? And the recommendation was just avoid everything that has kind of a massive overhaul in mind. Because if you're waiting for that one final definitive health reform, you will be waiting forever. Start with stuff that ideally doesn't require legislative change, that doesn't wait for the government, that you could do right away. Listening to the conversation today, I think actually it is time that we actually get at least partly that big health reform, because we can't go on like that anymore. But at the same time, I think that shouldn't stop us from just doing stuff that we can do right away.
Rob, final word to you this evening.
Well, my final word actually is going to be thank you, everybody. Oliver and the initiative, thank you for partnering with us the second time. I think it's been a really great day. To all of the speakers, I thought it was exceptional. I thought last year was really good, but I think this year was really gooder. So it was great. Chelsea and Michelle for pulling this together, an awesome job. Thank you very much. And Rachel for keeping us on time and corralled and just making everything flow and interesting and adding your personal insights. I think it's been a wonderful day. Thank you. And
indeed to NIB for making this possible, Phil. Yeah. So thank you.
And don't forget to stay for a drink. Yeah.
Thank you.
Thank you. Thank you.